Now coming towards previous studies reported about therapeutic drug monitoring of anti-tuberculosis drugs by dried blood spot technique. Very few studies have been reported about therapeutic drug monitoring of uh, anti-tuberculosis drugs by DBS method. So many other studies have been reported about immunosuppressants like TDM of antiviral drugs, TDM of antiretroviral drugs, antibiotics, and other potent drugs by dried blood spot. Okay, so now coming towards uh, anti-tuberculosis drugs. First of all, there is a study conducted in Korea. This is the only study that was performed on children. Okay, in this study describes pharmacokinetics of all first-line anti-tuberculosis agents except isoniazid. This study is successful uh, regarding uh, regarding therapeutic drug monitoring of rifampicin and pyrazinamide. The results of ethambutol in this study were not accurate. There was imprecision due to some influencing factors. Uh, so this study was totally successful regarding TDM of rifampicin and pyrazinamide. So, uh, in this study, pharmacokinetic curve was performed both with dried blood spot sampling and conventional venous sampling. Clinical validation was performed. In clinical validation, we compare the results of both conventional venous sampling and dried blood sampling. So in this study, comparison was done. So passing bubble comparison was studied by passing bubble regression. Blunt ultimate plots were used to assess agreement between uh, results of dried blood spot and plasma concentrations. So now no any significant proportional or systematic bias between DBS and plasma concentration showed. There were no any systematic bias, or there was no any significant proportional or systematic bias between dried blood spot and conventional venous blood sampling. So, DBS measurements showed acceptable predictive performance for rifampicin and pyrazinamide, but not for ethambutol. There was imprecision due to some factors. Uh, so, now another study is Another study reports that rifampicin from dried blood spot was extracted using acetonitrile and ammonium acetate buffer. Ammonium acetate buffer or acetonitrile is a mobile phase solvent to extract rifampicin. This study was also successful in extracting rifampicin. In this study, there was no any degradation seen in the dried blood spot. Uh, like some studies have, like one study has suggested that rifampicin binds to the matrix of dried blood spot paper, and rifampicin makes chelates with the ferrikines of matrix of the dried blood spot paper. So this is known as matrix effect. Matrix effect means when any drug binds to the matrix of the dried blood spot paper. In some studies, it has been reported that rifampicin binds to the matrix of dried blood spot paper and make chelates with the ferrikines. But here in this study, it was reported that there was no any matrix effect of rifampicin. Uh, this study was performed by Ellenson et al. The same research group tried to develop a method to determine isoniazid and pyrazinamide in dried blood spot based on gas chromatography coupled with mass spectrometry. Uh, this research group got success uh, in pyrazinamide, developing method for pyrazinamide was successful. Pyrazinamide results were okay, but isoniazid results were not okay because of oxidation and temperature instability. This research group showed that isoniazid has temperature instability. Like on room temperature, isoniazid is not stable. So dried blood spot sampling of isoniazid is not possible because of instability, temperature instability and oxidation reaction. So this research group suggested that isoniazid instability must be noticed when developing and validating dried blood spot. So another study about dried blood spot of moxifloxacin uh, by liquid chromatography coupled with mass spectrometry was performed. This analysis was also successful. Uh, Moxifloxacin is a second line agent. It is used for the drug resistant tuberculosis. This study was performed in drug-resistant tuberculosis patients. This study method of validation for this study uh, to measure to detect therapeutic drug monitoring of moxifloxacin was also successful. Another study of linzolid, uh, therapeutic drug monitoring by dried blood spot has been reported. This study was also successful. This study was performed in multiple drug-resistant tuberculosis because linzolid is also second-line agent of tuberculosis. Uh, Method of validation for the linzolid was liquid chromatography coupled with mass spectrometry. Okay, so now in linzolid study, clinical validation was also performed. Uh, like this results of dried blood spot were compared with conventional venous blood sampling. So results were compared by passing Bablock regression and blonde Altman plotting analysis. So this comparison or correlation study also showed a linear regression or linear results, like results of both DBS and conventional venous blood sampling were okay. So in coefficient of variation was also okay. It was less than 17.2% for the lower limit of quantification. So another study of rifampicin has been reported. In this study, plasma concentration of rifampicin and dried blood spot. Like in this study, plasma concentration of rifampicin were tested in 5 patients and were shown to be linear. In this study, correlation correlation analysis was performed, uh, like comparative study between dried blood spot concentration of rifampicin and plasma concentration of rifampicin. So the correlation between dried blood spot concentration and plasma concentration was linear. So this showed that also it was seen that there was more concentration of rifampicin in plasma than dried blood spot. So it was examined, it was observed that rifampicin has a higher affinity for uh, plasma than blood cells. So uh, rifampicin concentration was higher in plasma than the dried blood spot. Also, like it was analyzed that more rifampicin distributes in plasma than blood cells. Uh, Another study in multiple drug resistant tuberculosis patients was performed. This study was simultaneous determination of rifampicin and clarithromycin. This study was performed by liquid chromatography coupled with mass spectrometry. This study was also proven to be successful. Another study, like some studies have reported that isoniazid cannot be the therapeutic drug monitoring of isoniazid by dried blood spot is not possible because it shows it has isoniazid has instability on room temperature and also due to chemical reaction like oxidation. Isoniazid cannot be extracted, uh, and also it has been reported that isoniazid binds to dried blood spot filter paper, and it causes variable extraction recoveries. Like extraction recovery is not normal, not valid. But later, another method for the therapeutic drug monitoring of isoniazid by dried blood spot was developed. Uh, Another study has reported that therapeutic drug monitoring of isoniazid is also possible, and and the results were also successful. This study is application of isoniazid assay in dried blood spots using the ultra performance liquid chromatography coupled with tandem mass spectrometry. Like uh, previously, it was reported that isoniazid shows instability on room temperature, and it also shows oxidation, and it also was reported that it binds to filter paper. So recovery or extraction from the filter paper of isoniazid is not valid or possible. But this study shows that by ultra performance liquid chromatography, isoniazid recovery is possible and valid. This study was totally successful. So in this study, uh, concentration of isoniazid in plasma, venous and capillary dried blood spots were compared using 14 samples. Like in this study, dried blood spot samples were taken from plasma, capillary blood and venous blood. Three types of samples: plasma sample, capillary sample, and also uh, venous blood sampling. So three types of dried blood spot sampling was performed. So It was proved that in this study, ultra-performance liquid chromatography, isoniazid showed no any matrix effect. Matrix effect means isoniazid binds to matrix of dried blood spot paper. But in this study, it was proved that isoniazid showed no any matrix effect, and in isoniazid concentration in capillary dried blood spot was slightly higher than in venous dried blood spot. So it was proved that isoniazid has more affinity to blood cells, uh, like isoniazid concentration was higher in capillary blood, like finger prick capillary blood, than in venous blood. Uh, Clinical validation was performed by passing Bablock regression and Blunt-Altman plot were performed for comparison analysis. The stability of dried blood spots at room temperature was evaluated by measuring INH from 8 different spots at day 1, day 2, day 3, day 4, day 7, day 8, day 9, day 10, and day 28. Regression analysis purpose was performed to assess the statistically and technically significant changes over time. So this study was totally successful with regards to isoniazid therapeutic drug monitoring by dried blood spot by the method of ultra performance liquid chromatography coupled with mass spectrometry.